Hi, welcome to Eduwizz Academy. Eduwizz Academy is providing an online application program for licensed nursing exams like DHA, DOH, MOH, and Prometric. It includes 35 hours of exam-oriented theory classes, study materials, discussion videos, mock test, and so on. To know more about our application, please contact us. So let's go to today's question discussion. First question is, the nurse is preparing to administer prescribed amiodarone intravenously. To provide a safe environment, the nurse should ensure that which specific safety consideration is in place for the client before administering the medication. The question is about the medication which is called amiodarone, and what safety precautions should we have while administering amiodarone. Okay, so this is comparatively an easy question if you know about the medications. Okay, so the question is about medication named amiodarone and what safety considerations should be in place before administering the medication. So amiodarone, what medication is amiodarone? It is a well-known anti-arrhythmic medication which is used in cardiac arrhythmias like ventricular tachycardia. Okay, let's see about amiodarone. The medication is used to treat certain types of serious, possibly fatal, irregular heartbeats such as ventricular fibrillation or ventricular tachycardia. So this is an anti-arrhythmic medication. So by that itself, you will be able to give the correct answer. But let's see in details. It is used to restore normal heart rhythm and maintain a regular steady heartbeat. So generally, amiodarone is known as anti-arrhythmic drug. Okay, that means it is used to treat certain arrhythmias like ventricular tachycardia or ventricular fibrillation. So while giving a medication which is an anti-arrhythmic, what important safety precautions you should have in place? That is a question. Okay, so before going to the question, let's see some more points regarding amiodarone. Side effects of amiodarone are nausea, vomiting, constipation, and loss of appetite. And another side effect is shaking or tiredness. Okay, so the question is, while giving an anti-arrhythmic drug, what safety consideration is in place, should be in place? Options: A, oxygen therapy; B, oxygen saturation monitor; C, continuous monitoring; D, non-invasive BP cuff. So that's why I said, if you know about the medication, amiodarone is an anti-arrhythmic drug used to treat cardiac arrhythmias. So before administering an anti-arrhythmic drug, we should have a continuous cardiac monitor in place. So the answer is option C, continuous cardiac monitoring. Next question: the nurse reviews wound culture results and learns that an assigned client has methicillin-resistant Staphylococcus aureus (MRSA) in a wound bed. Okay. Which type of transmission-based precautions should the nurse implement for this client? So, a nurse is reviewing a wound culture and found that the patient wound is having MRSA, which is methicillin-resistant Staphylococcus aureus. So, which type of transmission-based precautions should the nurse implement for this client? So, basically, the question is about the transmission of MRSA infection. Okay, MRSA is also, the full form is methicillin-resistant Staphylococcus aureus. Options are A, enteric precautions, droplet precautions, contact precautions, and airborne precautions. So, what is MRSA or methicillin resistant Staphylococcus aureus? MRSA is a wound infection, a common postoperative wound infection. It is commonly seen in after surgery, and it is also most frequently or most commonly seen in athletes or sports persons. Okay, so it is, the important point is that it is a wound or skin infection. Okay, Staphylococcus aureus, MRSA, spreads through contact with infected people. So the transmission is through contact. Infected people or their wounds or things that have touched or infected skin and those who are carrying the bacteria. So it's spread mainly or commonly through contact with infected people's wound or the in contact with the people who are carrying the bacteria or those who have touched the infected materials used by the infected peoples. So basically, The transmission is from contact, and therefore we should use contact precautions. Options are enteric, droplet, contact, and airborne. And since the MRSA is transmitted through contact, we should have contact precautions. There is one more question regarding MRSA. The drug which is used for MRSA is vancomycin. The drug of choice for MRSA is vancomycin. Next question. A client with history of silicosis is admitted and diagnosed with respiratory distress and impending respiratory failure. The nurse should plan to have which intervention supplies or equipment readily available at the client's bedside to ensure a safe environment. A. Code card. B. Intubation tray. C. Thoracentesis tray. D. Chest tube and drainage system. So this is also, if you look at the question, what is the complaint of patient? Patient is having respiratory distress and impending respiratory failure. Respiratory failure is progressing or getting severe. So what equipment should we have in place? Options are code card, intubation tray, thoracentesis tray, and chest tube drainage system. Since the patient is having impending respiratory failure and respiratory distress, the first equipment that should be in the bedside will be related to respiratory failure. Which one is this? All these are related to respiration, but since the patient is having severe distress and respiratory failure, the most important equipment should be option B, intubation tray. Next question. This is regarding administration or ethical principles. The nurse gives medical information regarding the client's condition to a person who is assumed to be a family member. Later, the nurse discovers that this person is not a family member and realizes that this violation belongs to which legal concepts of nurse-client relationship. So, a nurse shared the information of a patient to another person who assumed to be his relative. It is not sure that he is not the patient's relative. And later, the nurse also recognized that the person to whom the nurse shared the information is not actually the relative of the patient. So, what are the ethical principles that has been violated? That is the question. So, sharing the personal information of a patient or not sharing the personal information of a patient is known as confidentiality. So, the ethical principle of confidentiality has been violated. So, what are the options? Let us see. There are 5 options. You can see usually there will be 4 options, but here there are 5 options. Duty to provide care, client's right to privacy, client's right of autonomy, client's right to confidentiality, duty to comply with the nursing standards. So, as I said, the first thing which was violated is the patient's personal information has been shared to someone outside of his family, who is not a family member of the patient. So, first thing that has violated is confidentiality. So, by sharing a personal information of a patient means the information which has to be kept secret has been published. So, confidentiality has been violated and the private information of the patient has been published. So, there are 2 aspects which has been violated. First one is client's right to privacy. Okay, privacy means his information should not be shared outside. And confidentiality is the ethical principle which maintains the privacy of the patient by not sharing the personal information. So, these 2 aspects, option B and option D has been violated. Okay, so let's see the answer. Answers are answer B and D, that is client's right to privacy and client's right to confidentiality. Next question, this one is also administration. In which situation is the nurse manager utilizing an autocratic leadership style? So, there are 4 situations given below. In that, which one describes the autocratic leadership style? So, what is autocratic leadership style? In autocracy or autocratic leadership style, the leader will make all the decisions and the subordinates or the employees should follow those decisions. So employees or subordinates are not involved in decision making. All the decisions and solutions are made by the leader itself. So that is called autocratic leadership. Now, if you see the options, first one, the nurse manager provides the solution for a unit problem. B, nurse manager allows the staff to solve their own unit problem. The nurse manager proposes several alternatives and has the unit staff vote on the best proposal. D, the nurse manager arranges for a staff meeting where all the unit employee can share proposals to solve a problem. So we already discussed that in autocracy, what happens is the leader will make all the decisions and solutions, and there will not be any involvement of subordinates in the decision making or problem solving. So if you see the options, the first option, the nurse manager provides the solution. It is clearly mentioned that nurse manager provides the solution for a unit problem. And if you see all the other three options, all the three options B, C and D allows the staffs to solve their problems, okay, and has the unit staff vote on the best proposal. All the employee can share their proposal. So options B, C and D allows the subordinates to give suggestions or gives the right to make decisions. So that comes under democratic leadership. So answer A, in which the nurse manager provides the solution. Okay, the nurse manager provides the solution for a problem is called autocratic leadership. So answer is A, which is the nurse manager provides the solution for a unit problem. Next question. The nurse is caring for a child with a diagnosis of intussusception. During care, the child passes a formed brown stool. Which action is most appropriate for the nurse to take at this time? Options. Note the child's physical symptoms. B. Prepare the child for hydrostatic reduction. C. Prepare the child and parents for the possibility of surgery. D. Report the passage of normal brown stool to the primary healthcare provider. So here the child is diagnosed with intussusception, and during the care, child passes a formed brown stool. The question is about which action has to be taken. So what is intussusception? Intussusception is a pediatric condition in which telescoping occurs. Telescoping means one section gets into another. It is known as intussusception. So what happens is the end portion of the small intestine gets into the starting portion of the large intestine. So ileum will enter inside the cecum. So there will be a fold at the junction of ileum and cecum. Okay, this is known as telescoping, which occurs in intussusception. And because of this fold, there will be obstruction of the intestine, which results in decreased blood flow, which in turn results in the destruction of the cells. So what happens is, because of the obstruction and destruction of the cells, there will be bleeding inside the intestine, and all the damaged cells, mucus and the stool gets mixed, and the appearance of the stool will be current red jelly like stools. So this is an important feature of intussusception. So let's see what is intussusception in details. Telescoping of ileum into the cecum, resulting in intestinal obstruction. Important clinical features are lower abdominal pain, projectile vomiting with bile content, most importantly palpable sausage shaped mass in the lower abdominal quadrant, and next one is also important, as I said earlier, red current jelly like stool. So these are the important clinical features in intussusception: palpable sausage shaped mass, current red jelly stools, and projectile vomiting with bile content. Diagnosis of intussusception is barium enema, and the initial management of intussusception is also barium enema or normal saline enema. If it is not cured by barium or normal saline enema, then another management is surgical management, in which we will do manual manipulation or surgical reduction. The surgical reductions are of two types: hydrostatic and pneumatic. Okay, so these are the management of intussusception. So The features are palpable, sausage shaped, and most importantly, the stool appearance should be red currant jelly stool. But here in question, it is mentioned that child passes a formed brown stool. Okay, formed brown stool is usually a normal feature of the stool. So, what action should be taken by the nurse? So, since the passage of stool appearance, the appearance of the stool is normal, the answer is report the passage of normal brown stool to the primary healthcare provider. So, there is nothing abnormal in that. If it is current jelly like stool, you should prepare for first barium or normal salema and also tell the parents about the possibilities of surgeries. So, answer is option D, report the passage of normal brown stool to the primary healthcare provider.